says reforms laying foundation for long-term stability. So there was an announcement by the CBN governor yesterday on the Monetary Policy Committee meeting. And so that headline is speaking to that. And another headline on the Point newspaper says, how Abacha died inside Aso Rock. Says, how Abacha died inside Aso Rock, ex-DSS director. Abacha is Nigeria's former head of state. And that also, still with the Point, federal government issues flood alert for 17 states, 6 emergency response plans. Federal government issues flood alert for 17 states, 6 emergency response plans. And also another headline on the Point, it says Kaduna man drags 27-year-old daughter to court over failure to get married. So what a day, what a way to start the day, what a headline to start the day. So Kaduna man drags 27-year-old daughter to court over failure to get married. So that's something to think about. And moving on to the Daily Monitor. And now on to the Daily Monitor today, Wednesday, July 22, 2026. The major headline on the Daily Monitor says NIHSA raises alarm over imminent flood in 17 states. NISA raises alarm over imminent flood in 17 states. And the subheadline under that says lists Bauchi, Edo, Imo, Kaduna, Plateau, Benue, and 11 additional states. And another subheadline under that says urges emergency management agencies, local government executives, community leaders to enforce safety measures without delay. And that is in the Daily Monitor. And another headline on the Daily Monitor says power reforms restore investor confidence. Presidency. Power reforms restore investor confidence. And you find that on page 3 of the Daily Monitor. And still with the Daily Monitor, MBF rejects Northern Security Trust Fund, accuses Sokoto Borno Caliphates of hidden agenda. NBF rejects Northern Security Trust Fund, accuses Sokoto Borno Caliphates of hidden agenda. And now onto the Punch, I beg your pardon. So on the Punch, the major headline on the Punch says, Reps intensify fake agency probe, give MDA's 48-hour ultimatum. Reps intensify fake agency probe, give MDA's 48-hour ultimatum. You find that story on page 2. And still with the Punch, Ondo Speaker faces impeachment as 21 lawmakers sign notice. Ondo Speaker faces impeachment as 21 lawmakers sign notice. And you find that on page 16 or 18 of the Punch. My eyes, I think it's old age. I really don't know what the problem with my eyes are this morning. So you find that on page 18 of the Punch. And another headline on the Punch says federal government floats 729 billion naira power bond August 3. Federal government floats 729 billion naira power bond August 3. And you find that on page 20. And still another headline on the Punch. Defense Minister denies quitting, threatens court action. Defense Minister, that is Christopher Musa, denies quitting, threatens court action. And that is on page 14 of the Punch newspaper. And just before we move on to another newspaper, another headline on another newspaper, there's a headline on the Punch that says Senate expands Safe Schools probe to TET Fund, NEL Fund. Senate expands Safe Schools probe to TET Fund, NEL Fund. And you find that on page 14 of the Punch. If you're just joining us, welcome. We are looking at what's making headlines today, as we do on the Roundtable every weekday at 8:30 a.m. If you would like to join us, if you would like to express your views about the headlines today, you can join us via WhatsApp on this number, 09030005915. now moving on to The Guardian. The major headline on The Guardian says Burnham implores cabinet to find ways to tackle cost of living crisis. On The Guardian, Burnham implores cabinet to find ways to tackle cost of living crisis. So that is the new UK Prime Minister Andy Burnham. And the United Kingdom and Nigeria, we share a lot of relationships. They are the 37th state of Nigeria. So everything that concerns the United Kingdom concerns us. So Andy Burnham, the new United Kingdom Prime Minister, implores cabinet to find ways to tackle cost of living crisis. So this cost of living crisis seems to be all over the world, in Nigeria, in the United Kingdom, and it looks like governments are putting measures in place to tackle the crisis. And now on the Blueprint newspaper, 31 firms win 37 oil and gas blocks in 2025 licensing round. So the major headline on the Blueprint newspaper says 31 firms win 37 oil and gas blocks in 2025 licensing round. And you find that story starts on the front page, but you find it continues onto page 8. And also, still with the Blueprint newspaper, 12 jailed 6 months for Naira abuse in Warri. 12 jailed 6 months for Naira abuse in Warri. And you find that on page 8 of the Blueprint newspaper. And also on Blueprint, sports, WAFCON, Super Falcons camp swells to 23 players in Casablanca. WAFCON, Super Falcons camp swells to 23 players in Casablanca. So that is the AFCON, but this features the female national football teams of African countries. And the camp for the Super Falcons swells to 23 players. And you find that on page 32 of the Blueprint newspaper. And now on the Nigerian Tribune, today, Wednesday, July 22, 2026, the major headline on that paper says ONSA SGF disowned Adeyemi during 2025 inquiry, Foreign Affairs Ministry. ONSA SGF disowned Adeyemi during 2025 inquiry, Foreign Affairs Ministry. And subheadline under that says reps to meet Minister of Justice, Accountant General today. And you find that story on page 9. And also, another headline on the Nigerian Tribune, it says Edo, Kaduna, Niger, 14 others at flood risk before July 27. Federal government warns. Edo, Kaduna, Niger, 14 others at flood risk before July 27. Federal government warns. And you find that on page 4. And also on the Nigerian Tribune, troops rescue 27 kidnapped victims, foil abduction in Sokoto. Troops rescue 27 kidnapped victims, foil abduction in Sokoto, and you find that on page 27. And there's a health headline on the Nigerian Tribune that says, eating more beans, soy, / high blood pressure risk by nearly 30%, study says. Eating more beans, soy / high blood pressure risk by nearly 30%. Today's Wednesday, and on Wednesdays on the roundtable, we discuss everything health. And we have got a doctor with us today. So maybe, we would ask our doctor about that headline and eating more beans and soy. And eating more beans and soy will help / blood pressure, high blood pressure, the risk by nearly 30%. So I'm interested to learn more about this. If you're just joining us, welcome. We are looking at what's making headlines today in Nigerian newspapers. Today is Wednesday, July 22. And as we do, we look at what's making headlines. If you'd like to join us, if you'd like to express your thoughts, your opinions about the headlines that we have read out to you so far, you can contact us via WhatsApp on 09030005915. And you can also call us on 09030006915. And now we move on to the Vanguard. The major headline on the Vanguard says, reps to ONSA explain why you ignored alert on PFIPC. Reps to ONSA explain why you ignored alert on PFIPC. And you find that story on page 5. I think this PFIPC controversy has been ongoing for a while now, and I think Nigerians are glued to the papers, to the news and radio and television and everywhere to find out for updates on the PFIPC scandal. That sounds like a mouthful, and it is. And another headline on the Vanguard is xenophobia. Reps seek compensation as South African economy suffers. Xenophobia, reps seek compensation as South African economy suffers, and you find that on page 11. So I wonder if there is a link between the evacuation of African migrants from South Africa and this headline saying the economy, South African economy, is suffering at the moment. I wonder if there's a link to that. If you would like to let me know your thoughts about that, you could send a message on 09030005915, and also you could call us and talk about that on 09030006915. And still with the Vanguard, ECOWAS reaffirms plan to roll out ECO single currency in 2027. ECOWAS reaffirms plan to roll out ECO single currency in 2027. You find that on page 9. I'm interested to know how Africa would deal with a single currency, like Europe, and they've got the euro. So with West Africa, because ECOWAS is, the West African states. I'm interested to see how that would work for the West African countries, and it'd be interesting to see how that plays out. If it does come to fruition, it'd be interesting to see how that plays out. And still with the Vanguard, insecurity. Tinubu approves new army battalion for Kwara. Insecurity, Tinubu approves new army battalion for Kwara. And you find that on page 27 of the Vanguard. PFIPC illegal. And still with the Nation newspaper, there's a headline saying CBN, stable interest rate to consolidate gains. And you find that story about the CBN, stable interest rate to consolidate gains, on page 3 of the Nation. And still with the Nation, $500 million World Bank backed agri scheme takes off. $500 million World Bank backed agri scheme takes off, and you find that on page 2 of the Nation. And on Daily Trust this morning, the major headline says AG mandated us to open accounts for Phantom Council, CBN. AG mandated us to open accounts for Phantom Council, CBN. And the story starts on the front page of the Daily Trust newspaper, and it continues on pages 3 and 4. And also there's another headline, and it says, How Thunderstorm Claimed 6 Children. And this is on the Daily Trust. It says, How Thunderstorm Claimed 6 Children. This is incredibly sad about the lives of these 6 children that have been lost in the thunderstorm. And our condolences go out to the families, the victims and their families, with this very, very sad headline. If you're just joining us on the roundtable, we have just looked at what has made headlines. What is making headlines? So today is still ongoing. So what is making headlines today in Nigeria? July 22, Wednesday. And if you are just joining us, welcome. We will take a quick short break and we'll be back after this. Stay with us.
The capital is alive. The streets are moving. The people are vibing. And the one station powering it all? Clean Beat 91.5 FM Abuja.
Offers certified drug testing services.
Need a drug integrity test or visa clearance certificate?
For employment, visa processing to Thailand, Malaysia or India, school admission, court use, or just peace of mind.
Good news, you can do it all from the comfort of your home.
Just log on to drugandvisa.ndlea.gov.ng.
Create your account, pick a test date, choose your location,
and get your certificate fast, safe, and verified.
No agents, no queues, no paperwork.
Apply direct, get your clearance, travel free. This message is from the National Drug Law Enforcement Agency, NDLEA.
Life in Abuja comes with its rhythm. We amplify it, we celebrate it, we broadcast it all day long. Clean Beat 91.5 FM.
Clean Beat 91.5 FM. My name is Tokumbo. Right. I realized I didn't introduce myself properly earlier, but my name is Tokumbo Wright, and I will be hosting the roundtable today on Clean Beat 91.5. You can join in the conversation on the roundtable as always. You can send messages via this WhatsApp number on 09030005915. That is 09030005915. And you can also call us on this number 09030006915. Once again, that is 09030006915. So as I mentioned earlier, today's Wednesday, and on Wednesday we talk everything health. And we have got a medical doctor to talk very healthy things with us today. But before I introduce our guest for today, our topic is antimicrobial resistance, what every Nigerian needs to know. That is antimicrobial resistance, what every Nigerian needs to know. Now, antimicrobials are medicines used to prevent and treat infectious diseases in people, animals, and plants. Even I didn't know that. Now, these include antibiotics, antivirals, antifungals, and antiparasitics. Now, antimicrobial resistance occurs when bacteria, fungi, viruses, and parasites develop the ability to defeat the drugs designed to kill them, and they just continue to grow. They just carry on. Now, according to the World Health Organization, WHO, antimicrobial resistance is a major global health threat. And it says in 2021, bacterial antimicrobial resistance was estimated to be associated with more than 4.7 million deaths globally. Now, joining me today to talk about antimicrobial resistance and what every Nigerian needs to know is Director, Strategy and New Business, Nigeria Health Watch, Dr. Adachi Eke. Dr. Eke is a medical doctor and public health leader with over 8 years of experience strengthening health systems across Nigeria and Africa. Good morning, Dr. Eke, and thank you for joining us today on the roundtable.
Good morning.
So just jumping right into it. What causes antimicrobial resistance?
So, many things.
Okay. So give us a few. Let's see.
Okay, so you rightly defined what antimicrobial resistance was
Okay.
or is, and
Okay.
then what causes it?
Yeah.
When people don't take the right drugs.
Okay.
One, when we self-medicate.
Right. Okay.
Two, when we don't finish our course of medication.
Okay.
Sometimes in households they share medication. So I use some days. Oh, you seem to develop the same rash. You know what? I didn't finish it because my rash kind of cleared. You can take it. It's the same thing.
So
Then
you
you
say
take
we
it.
can't do that?
No, we cannot.
Really?
We
Okay.
are not allowed to do that. And these
Okay.
are, and it's not just, antibiotics. These
Okay.
are just, antimalarials.
Okay.
You start, you're like, oh, I have a little bit of headache. It's Nigeria. It's malaria. And then you start taking the drugs.
Okay.
But it's not because you haven't really checked. You haven't tested.
Okay.
And then you take it. And then the next time it's not, then you have a bit of it in your system.
Okay.
When the mosquito bites you, the parasites starts developing, their DNA starts morphing.
Okay.
And then the medication can work against them now.
Okay.
And so you tend to take more medicines. You tend to take stronger medications. You tend to stay longer in the hospital. Then that's when they start going to the hospital. Oh, I've taken the malaria medicine. It did not work. And then someone goes, oh, try another one. Try this one. Oh, maybe it's injections I need.
Okay.
Or maybe it's something else I need. And
Okay.
then you start doing this. And then you spend longer in the hospital.
Okay.
You're spending more time being sick.
Okay.
There's more, you're spending more money on it. And these are all the reasons why. You can't, or these are all the reasons that lead to the antimicrobial resistance.
Okay. So why is antimicrobial resistance seen as a global health threat?
Because imagine the medications that are supposed to make you better.
Okay.
And then these medications are no longer making you better.
Okay.
So now we need more research to have stronger meds.
Okay.
So instead of the money being spent on the actual meds that are available, you are spending it more on research.
Right.
for the same disease that a cure was developed for already.
Right.
And then people are dying because now you are resistant. Before they can find the right medication that will get to you, people are now dying of diseases that they could have been cured from anyway. So this is threatening to the world and is a silent killer.
Okay, so are you saying that, resources that could have been otherwise used for emerging illnesses, like, for example, COVID, and the research that could go into it, the resources that could go into it is instead channeled into treating illnesses that medication already exists for, treatment already exists for. So that's why it poses as a global health threat?
Yes.
So does antimicrobial resistance affect only a specific group of persons, or is it everybody?
No. It can affect everyone.
Okay.
So it's not just a group of people.
Right.
It's because if the bacteria that has bacteria, fungi, the microbes,
Right.
the viruses, the parasites, if they have developed that strain
Right.
of resistance, then they keep multiplying.
Okay.
And if they multiply, and then that's the now more common one, then
Right.
we're in deep trouble.
Right. So you're saying it can affect us here in Nigeria, so low and middle income countries, but even in high income countries as well.
Yes, it can affect everyone, but then why is worse here?
Yeah.
Is because our health system is not the best.
Right. So let's say I develop some sort of antimicrobial resistance, and I know some sort of is putting it mildly or lightly. Does that mean that it renders my body totally, completely resistant to every other type of medication, antibiotic, antifungal, antiparasitic medication
So it
administered?
depends on what you're resistant to.
Okay, so there are specific resistance.
Yes.
Okay.
So it depends. So like in East Africa, for example, there's a lot of anti-malarial resistance already.
Okay.
Luckily in Nigeria, there hasn't been a record of this.
There isn't?
Luckily, that's what the data says.
Okay.
But then again, though,
Yeah.
are we really completely sure? Are we recording everything that is out there?
I'm actually interested by that line, and the reason why I said there isn't is because there was a time that every week or other I would have malaria every time. So I'm thinking, what was the cause for that? So using myself as a case, example, what was the cause for that? If we haven't been able to record the anti-malaria resistance in Nigeria, do you think, like you say, maybe there are instances of it, but we do not have a record of it like in East Africa?
Yeah, I think that's what it is. You can't be completely sure.
Okay.
I mean, but data says there isn't.
Okay.
So yes, we're lucky on that, but then that doesn't mean we shouldn't stop the behaviors that would lead
to that.
Yeah.
Okay, so apart from what you explained about, like, for example, I have some malaria medication, I didn't finish it, and then a person in my household has got a headache, and then they carry it on. Apart from that, what other key factors contribute to the emergence of antimicrobial resistance?
So you didn't finish a full course of any drug.
Any medicine, okay.
Yeah. That's not good.
Right.
Self-medication, because you don't know what exactly is wrong with you. Now, there's so many illnesses that present the same.
Okay.
You can have a flu, and it's just the flu.
It's just the flu?
Yes.
Okay.
And usually viral infections don't last more than 2 weeks.
They don't?
Ideally. If it's just like, respiratory viral infection, it doesn't last more than 2 weeks.
Oh, really?
So it can just be a flu, and then you start taking antibiotics. Antibiotics are for infections, like bacterial infections.
Okay.
So imagine you have a viral infection, and then you're taking an antibiotic for.
Right. So you're saying misuse and overuse of medication, and in Nigeria we have that self-medication behavior.
We do. Usually our first point of contact is usually the nearby pharmacy. The nearby chemist. Sometimes people just call up their friends that is a pharmacist.
Okay.
And then And not to say that there are not really good pharmacists out there,
Right.
but then pharmacists are not doctors.
Right. Okay.
A doctor would listen to everything, or a health practitioner in the hospital will listen to all your different symptoms and tie it all together. But a pharmacist will say, oh, you have a cough, this is a cough medicine. Oh,
Right.
you have a cold, this is for your cold. Oh, you have this, oh, this is for this. Sometimes it doesn't always work that way. Sometimes one medication can stop all of those. But then
Oh.
when we go and self-medicate, oh, I have a sore throat, oh, this is how my body feels when I have malaria. And why do people do this? And I'm sure some people might want to know, why do people do it? Because maybe when they go into the hospital, it takes forever to get seen. Or when they go, the healthcare workers, you don't have enough, or they don't treat you as nice.
Okay.
Or so we already have a strained medical health system. And some people will say now all the good doctors have jackpot, and so we have very few left.
Right.
Or they come up with a story of don't let Nigeria happen to you.
Yeah.
And everybody goes on Google and types in or some people will type in on Google, oh, I'm feeling like this, or I'm feeling like this, or I'm feeling like that.
Yes.
And then they say, oh, take this, take this, take this. But then there are other questions that a
Need
health
to be asked.
yes, and
Okay.
that will tie it all together. And then we go self-medicate. And I'm talking like this because this is practical.
Right. So you are saying that proper diagnostic facilities and tools would help to contain antimicrobial resistance. So if we follow the correct chain of when we're seeking treatment, so we go to a hospital, we see a doctor, we talk about our symptoms, the doctor now, okay, this is what we have deduced from it, and then you are now prescribed drugs, and then you proceed to the pharmacy.
Yes. And then most likely the doctor to also do some tests. And these tests are not testing to see, but also testing to rule out that there are not other things there. Yeah.
So do you think that there are other things like maybe for example, maybe poor access to clean water? Can that contribute to the emergence of
definitely. So now we're now taking it back.
Right.
So in the first place, what causes the infection?
Yeah. Okay, yes.
So let's start taking it back to then our behaviors. You're not drinking the clean water.
Okay.
There's sanitation, hygiene, and these are the things that should be taught in schools.
Right.
And these are the things that should be practiced at home.
Okay.
So you're not taking your prevention. There are things that you should do. Even eating contaminated or food can lead to some infections. So
okay,
yeah, I mean, this is rainy season. One of the things that come up during rainy season is the outbreak of cholera.
Yes, that is true.
And that's because our environments are not clean. Waste gets mixed, and when I'm talking about waste, I'm talking about fecal
Matter.
Yes. It gets mixed with food.
Yeah.
And then you eat that.
Right.
And then you have the infection.
Right.
And then you start out, oh, maybe I should just take some ORS. But then, no, this is not stopping. Oh, so let me take some antibiotics. Oh, I'll go take amoxicillin. Oh, no, just take Flagyl, for example.
I was coming to Flagyl because as a Nigerian, there's no way you have not heard Flagyl.
Flagyl.
Right.
Oh, yeah. And then let me just start taking Flagyl. And then you start taking Flagyl. And then you realize, it's not stopping.
It's not working.
Because you don't need oral. You need probably IV at that point.
Right.
And then what the person then dies of, you say, oh, the person died, the medication is not good, or is expired, or is fake. But actually you needed, something that would act faster, which is probably the IV.
Right.
And then the person probably died of dehydration.
Okay.
Because that's what would kill you faster, because your body goes into shock. You've lost so much fluids, and that's what happens. But then we say, oh, it's fake medication. Oh, it's Nigeria. Oh, Nigeria has happened to me. Oh, the good doctors have left. But you present really late.
Right.
And then you spend more. And then you say, anytime I go to the hospital, they're making me spend more. Well, you didn't come early.
Okay, so actually, I like that you brought up the point about fake counterfeit medicines. We're going to talk about, we're going to touch on that and its effect, its contribution to the antimicrobial resistance, but it will be after the break. So if you're just joining us, this is the roundtable. We are talking about antimicrobial resistance, what every Nigerian needs to know. We'll be back. Stay with us. We'll be right back after this short break. Thank you.
This is Clean Beats 91.5 FM. Our beats hit better than any other substance.
Drugs bring heartache and pain. That's why we're doing this campaign. They draw you in, thrust you out, and leave you begging for mercy, for currency, and that one last drag with no dignity. Drugs have no gain. They bring nothing but shame. Reach out, seek help. That's why we're doing this campaign.
This message is brought to you by the National Drug Law Enforcement Agency, NDLEA.
I am Brigadier General Mohammed Boob Amarwa, retired, Chairman, Chief Executive Officer of the National Drug Law Enforcement Agency. To my young people, your talent is greater than drugs. Protect your future. Stay drug-free. Keep flexing with Clean Beat 91.5 FM Abuja.
This is the Round Table.
Welcome back to the Roundtable. My name is Tokumbo and I'm your host today. If you'd like to join in the conversation, our topic today is antimicrobial resistance, what every Nigerian needs to know. So if you want to ask questions to our guest is Dr. Adachi Eke. If you'd like to ask her questions about antimicrobial resistance and anti-malarial resistance, you can send a message via WhatsApp on 0903000 5915. And you could call us as well on 0903000 6915. Now, Dr. Adachi, just before the break, we're talking about counterfeit medication, fake medication. How does that play a role in the rise of antimicrobial resistance?
So with the fake medication and what that does is it breaches trust.
Okay.
Because people, there's fake medications in some places, and then when that bridges trust, people start losing trust in the health system.
Okay.
And then it's now, oh, let me just buy my drugs ahead of time. I know that this place has good medication, and then let me buy my drugs ahead of time. And then you can buy ahead of time and you may forget to check expiry date, and then you start treating yourself. And so it still leads to the whole encouraging the self-medication habit. But then there's something I also wanted to mention.
Please do.
And this is about, animal health and plant health.
Okay.
So, we keep making it look as if that it's only the human beings.
Okay.
But then farmers and livestock, cattle rearers, and antimicrobial resistance is a One Health problem. So we call it One Health because it's not just on human beings, there's also plants and there's also livestock rearing. And so with that, you have farmers, some of their livestock are sick, so they just give them antibiotics without properly going to the vets. Yeah, and so they give them all of this, and then we buy this meat, or we buy the cattle, or we buy, it's salad time, we buy the rams and we kill it, and then we eat them. But then they're all heavy. There's a lot of antibiotics in them, or microbes, so depending on different organisms, right? There's a lot of antimicrobes in them, and these stay in it for a while, and then we eat it.
Okay.
And then we have these, and all of these are all chemicals in the end when things are being broken down. They're broken down to, remember chemistry, you have those lines in everything is being broken down to chemicals in the end as to what we eat and what we put in our bodies.
Okay.
And then that's the same thing with the spread. And that's how things can even be spread from animals and plants. And so, this is not just
for humans
alone, but for farmers and the livestock rearers as well.
So you spoke about the the eroding of public trust in medicine, when we're talking about fake counterfeit medicine, does antimicrobial resistance reduce human productivity? That's one, because you're talking about your One Health model. Does it reduce human productivity? And does it also reduce productivity with animals and in farms, so threatening food security, as you have just mentioned about, because of what's happening in the livestock and agricultural industry as well?
Yes, it does. And so I mean, so antimicrobial resistance, is a long, I would say, like a range. So you start with prevention. So if your prevention is not done right, it leads to infections. These infections may be viral. It might be bacterial infections. It might be fungal infections. It might be parasitic infections. So if prevention is not done right, if your environments are not kept clean, you're not washing your hands properly, you're drinking contaminated water or eating contaminated food, or eating food that has been pumped with a lot of antibiotics or antimicrobes from the farm.
Right.
And so now that leads to resistance, because now you have an infection, then you decide to self-medicate, or with the animals on the farm, or with your plants, your pesticides that you spray everywhere, you then decide to self-medicate, because spraying and putting all of those makes it it's self-medication. And then you do this, and then the bacteria, they're in your body, and you keep doing this, and then you don't finish the course, like, oh, they seem to be getting better, or I seem to be getting better. And then that leads to more resistance, because the next time you're going to use that drug, because you didn't finish it, the bacteria builds some form of shield around it. And so, or the organisms build some form of shield around it, and that leads to the resistance. Now, what is now the outcome of it? You're spending more money in the hospital to get better. You're spending more time, and that now leads to the productivity of it. And then what that happens now, imagine if, so it's, it looks small when it's just one person or two people, but imagine it becomes hundreds of thousands of people in Nigeria, for example. And then that then leads to the economic productivity that starts affecting our GDP. Now we can produce as much. Now you have employers complaining because their employees are sick, and then you're not delivering on your work on time, and then you're not getting paid, you get fired, you lose your job.
If you're always ill all the time.
If you're always ill all the time, you lose your job. Once you lose your job, now you can't fend for your household, you can't fend for your kids, you can't fend for yourself. You're looking for, it leads to more unemployment rates.
So you're saying that as a global health threat, it also has economic repercussions as well.
Exactly. And so once it becomes that, then there's a lot of crime rates now going up, because everybody's just
everyone's out of a job.
Yes, everybody's sitting down, and then we're looking at other people going to job, and it's like, what do they have and I don't have? And then that leads to more and more, and then it just keeps going downhill from
Just keeps spiraling.
Yeah.
I don't think I've ever seen seen the link between malaria reoccurrence and economic decline explained so perfectly. Thank you for
You're
that.
welcome.
Actually, I'm sure our listeners too, they understood that very well. So if you're just joining us, welcome. This is the Round Table. Today we're talking about antimicrobial resistance and what you need to know as a Nigerian. Our guest is Dr. Adachi Eke. I thought I missed it. I missed it.
No, you didn't.
Dr. Eke is a medical doctor and public health leader with over 8 years of experience strengthening health systems across Nigeria and Africa. And today she's here to talk to us about what we need to know, prevention measures we can put in place to stop and to contain antimicrobial resistance. If you'd like to join in the conversation, send in a message via WhatsApp on 09030005915, and you could also call us on 090306915. So, Dr. Eke, you were talking about the impact on healthcare costs, because you're saying the longer you leave it, then the more money you have to spend when you go to hospital. So what can Nigerians do to ensure that, access to healthcare is it's a bit of a struggle currently. What can Nigerians do to ensure that they do not spend a longer time in hospital because then it's prolonged stay in the hospital. You need, more treatment. What can they do to ensure they do not get to that point?
I think the best thing everyone should do is, find a local clinic close to you. So whenever you're ill, that's your first point of call. And that's rather than a pharmacy or rather than, what you think is best. Go to the clinic, a primary healthcare center, a hospital, go there. That is actually the best. And then whilst you're there, they will treat you. If they see that it is more advanced than what they think and what they can handle, then you're properly referred to like a specialist to take care of you. That is the ideal thing to do. But we keep trying to jump the gun and go straight to treatment.
Game the system.
But then that is ideally the right thing to do. So identify, find your local clinic, find a place close to home, close to you. That's why the closest one to you, go there first. Hear from a professional, get tested. Don't assume that you think you know what it is. It just might be something else.
Right.
Because a lot of things present the same way. So just go somewhere else. Go to the clinic, not somewhere else. Go to the clinic. Get tested.
Yeah.
Complain to a doctor or a health practitioner there, because sometimes in some places you have, a midwife or you have someone there, but complain to them, let them direct you as to the next step to do. Yeah.
So you're saying that when you
and then carry
on, please.
Yeah, and then also practice a lot of safe hygiene, water, sanitation. Ensure that your water is clean before you drink it. And also when you see something wrong, say something. Correct the next person. You see someone, and if you're a pharmacy, I know we're all there trying to make money and trying to earn a living. But please, when people ask for some medications, please ensure that they have a prescription.
Right.
So that the things are not sold without a prescription. And then that covers you.
Okay.
Yeah, because one thing that we have, NAFDAC has enforced it, and they're there for regulation, right? But then one thing we don't do enough is the enforcement of the regulation, and who does it, right? Who gets paid to do this?
Right.
But I think we all can do something. So if you're a pharmacist and you own your own pharmacy and someone comes to you and you say, I have this, you say, oh, do you mind going to a hospital and getting a prescription first? And then you sell based on prescription. So you know that it's been actually prescribed and you keep your records.
Right.
It's better for every other person. And you never know, you're saving a life out there.
Wow. So you've heard Dr. Adachi. So she says, go to a hospital, go to a health facility close to you, find one that is within walking distance, find one and follow the proper channels of treatment. Speak to a doctor, seek a consultation, tests will be run, you get a prescription. Do things properly to safeguard your health. So Dr. Adachi, so we've spoken about what individuals can do, and now, we're going to go on a short break to catch our breath. But when we come back, we're going to talk about now what regulatory agencies can do. I mean, you touched on NAFDAC and what regulatory agencies, government agencies, the Ministry of Health and Agriculture in this case, because there's livestock that is been fingered in this, and also the awareness and enforcement of relevant legislation, what the government can do.
Yeah.
So we'll be back right after this break. Stay with us. We'll be back, me and Dr. Adachi, talking about antimicrobial resistance.
Doctor-approved medication only. DJ-approved jams all day. On Clean Beats 91.5 FM Abuja.
Do you know the NDLEA offers certified drug testing services?
Need a drug integrity test or visa clearance certificate?
For employment, visa processing to Thailand, Malaysia, or India, school admission, court use, or just peace of mind.
Good news, you can do it all from the comfort of your home.
Just log on to drugandvisa.ndlea.gov.ng.
Create your account, pick a test date, choose your location,
and get your certificate fast, safe, and verified.
No agents, no queues, no paperwork. Apply direct, get your clearance, travel free.
This message is from the National Drug Law Enforcement Agency, NDLEA.
When the city needs clarity, when the people demand energy, when the moment calls for pure vibes, only one station delivers it all. Clean Beats, 91.5 FM Abuja.
This is The Round Table with Itoan.
My name is Tokumbo, and I'll be your host today, sitting in for Itohan. Our topic today, we've been talking about antimicrobial resistance, what every Nigerian needs to know. And joining me in the studio has been and is Dr. Adachi Eke, medical doctor. She's the Director, Strategy and New Business, Nigeria Health Watch. Dr. Adachi leads organizational strategy, grant development, program design, and evidence-driven initiatives that influence health policy and accountability. Her frontline clinical experience, combined with expertise in policy research and health economics, positions her as a key voice on health equity and sustainable health system reform. I mean, Dr. Adachi just spoke about the link between recurring malaria infections and economic decline, the repercussions on the economy of a nation. Dr. Adachi, thank you for joining us again. So before the break, we're talking about, so this is what you spoke about, what individuals can do in terms of, okay, what you can do to contain the spread and emergence of antimicrobial resistance, like practice safe hygiene, follow the proper channels of treatment when you come down with any sort of infection, because you say some of these illnesses present with the same symptoms. So it's best you go to a healthcare professional that can consult, diagnose, and then, prescribe for you. Now, coming to government, you also touched on regulatory agencies like NAFDAC, what they can do. What can NAFDAC do in terms of ensuring the standard and quality of medication that Nigerian medical facilities use in treatment of these illnesses to prevent antimicrobial resistance?
Okay, thanks, Tokumbo.
Thank you.
Before I talk about NAFDAC, I think I'll talk about the government in general.
Okay.
So under the Federal Ministry of Health,
Right.
Who is in charge of our health and social welfare of every Nigerian, they actually have a plan. It's called the National Action Plan on Antimicrobial Resistance. So there was a 1.0 first plan, and then there was an updated plan, which is the 2.0.
Okay.
And that was released in 2024. I know it was done under the it was done with the National Center for Disease Control, who also is a part of the federal
NCDC?
Yes, NCDC, who is a part of the Federal Ministry of Health.
Yeah.
And then they did it also in collaboration with the Ministry for Agriculture and
Excellent.
Livestock. So ensuring that this is a One Health plan.
Okay.
Yeah, and so under that, so you have a plan that is supposed to be followed.
Right.
Then we have the NAFDAC, who also contributed to it as a regulatory agency.
Right.
But then in order to do the regulation is there, the rules are there.
Yeah.
Our issue in Nigeria is enforcement.
Okay.
So how do we make sure that people who falter, what happens to them? Do you close down everybody's business who doesn't, every pharmacy who doesn't use prescriptions before they prescribe, who brings in those drugs anyway? So there is a full plan for this. Is it customs who has to clear the medications before they come in? So at what point do we, so everybody has a section, in the whole ecosystem in Nigeria. So what part is yours, and how well are you enforcing what you're supposed to be doing?
Okay.
So for every pharmacy that has been registered, before they get their license, did they follow the rules? There should be records. How do you ensure those prescriptions are checked?
Right.
How do they receive their licensing for the next year or for the, whatever the license is? How do they ensure that they receive their license? There's supposed to be, for every pharmacy, there's supposed to be a licensed pharmacist that is attached to that pharmacy. Do you have one? So yes, maybe they get somebody and they say, oh, hey, give me your license. Let me use it to apply. And then they pay the pharmacist and all of that. But the pharmacist is not really there. So how are all those things enforced, and how are all those things ensured that this is not happening? So where does it lie? this lies at the NAFDAC, and also at the pharmaceutical licensing bodies.
Forward. Okay.
So what are those things that you're supposed to do to ensure that, look, we're delivering to our, because when you're called into leadership, you're called to serve.
Right. Okay.
Right? Because, so how do you ensure that what you're supposed to do, you're doing it, for the people you're supposed to be serving?
Mm-hmm.
So, and at what point do we, is accountability measured?
So you also spoke about the Ministry of Agriculture. What can be done to ensure that, like you mentioned earlier in the show, you said that farmers would see that the animals have some sort of infection and they just feed them with antibiotics. So if let's say, for example, they suspect it's a bacterial infection, then they feed them with antibiotics, but that is not the correct line of treatment. What can the Ministry of Agriculture do to curb the indiscriminate use of these medicines?
So for me, I feel like what they can do, there's a protocol that, farmers are supposed to have.
Okay.
And then they're supposed to be licensed.
Right.
They're supposed to have their vets and, the veterinary doctors that see these farmers. When you have a large farm, you're supposed to register, the number of birds, the number of animals you have, and things like that. So there is a protocol that you're supposed to follow.
Mm-hmm.
And so how do you ensure that these
protocols are followed,
adhered
to?
Yeah, exactly. And especially because who then is one of the biggest issues are with the private sector.
Right.
So this is my own business, but for you to open that business, there are things that you should do. It's just like, you want to open a company, you need to have your CAC, you have to do all of this, and then who ensures that your taxes are being followed, you're paying your taxes, things like that.
Right.
So that's the type of regulation that should be employed on everything. Yes. And if that is done, because if you do it on, corporate organizations, why can't you do it on other organizations that are not necessarily corporate, but then they're still businesses?
Okay.
Yeah. So it's not just taxes, but then there are other protocols.
It translates into other parts of the business as well. So,
yeah.
So what are the medical interventions? So are there avenues for not using maybe medication when you're treating these illnesses? So in a bid to disable the mechanisms to prevent the whole mutation in the DNA, whatever. So are there other medical interventions that can be explored in disabling the mechanisms that these microorganisms use to resist treatment?
No, definitely. There's need to be a lot of research and development that goes into things because things change every day. The only thing constant is change. So definitely a lot of research
would go into that.
Will go into that. But then we also need to and then when we start seeing that other countries are developing some resistance, we should also learn from them. And have that shared learning where, this is what you did, this is what you do. And thankfully WHO also has all their guidelines that they provide to different countries.
Yes.
And then in Nigeria will be hosting the antimicrobial resistance conference in December this year.
Nice one.
And it is a global conference. And so there we get to learn what to do, how to prevent, what other regulations have been enforced in other countries, what is working, and how can we learn and then share and then, contextualize for your own country. So Nigeria will be hosting that. Last year, you also have different organizations that have been working in this space. Nigeria Health Watch for one. Nigeria Health Watch, we are a health communications and advocacy organization. So what we ensure is every Nigerian has the right information to make decisions about their health. Hence why I am here talking
so all in the awareness.
And
drive.
giving everyone the right information so that you can make
best decisions.
Informed decisions, the best decisions that you can with what you have.
Okay.
And so last year, there was a conference in Lagos where you have a lot of private sector laboratory equipment, people who, develop a lot of things. They come together. It's called the World Health Expo. And Nigeria Health Watch hosted a side event. They're talking about antimicrobial resistance. We have brought in people from the Ministry of Livestock. We have brought in people from NAFDAC. We had brought in people from, NCDC. We had brought in WHO. And everyone sat together to see what can be done,
Okay.
and what are we doing, and where are we in this race
So far.
Yeah, so
in the
far.
race.
Yeah.
So you're saying a collaborative approach between
Yes.
relevant stakeholders,
It's
CSOs,
multi-sectorial.
NGOs,
Yes.
research organizations, and then cross country as well would go a long way in
Yes.
containing antimicrobial resistance.
Definitely, everyone has a part to play.
Right. So one last question. Will access to vaccines ensure protection against antimicrobial resistance?
Oh, definitely. Vaccines are always preventive
Okay.
because these are diseases that are preventable.
Right.
So that's why they're called vaccine preventable diseases, right?
Okay.
And then when people take these vaccines, they would protect you from having the infections in the
the
future.
first place.
In the future. Yes,
Okay.
exactly.
Okay.
And so you develop antibodies, you develop some immunity
Okay.
towards this disease. So yes, people should get vaccinated. It's not vaccines. I know that there's some myth and rumors about vaccines, but vaccines are good for you.
Okay, so just before we wrap up, can you just talk to Nigerians about this is antimicrobial resistance, what you can do to contain it, what you can do to prevent the spread, and how to safeguard your health?
Yes, and
Quickly.
I think I'll do this by asking some questions.
Okay.
And so to every Nigerian out there, have you ever bought antibacterial medication, so
Over the counter.
antibiotics, without seeing a doctor?
Yeah.
And you don't have to, answer this in your mind. Have you ever done this without seeing a doctor? Have you ever finished any drug? Like you have finished it? If yes is your answer, that's good.
Yeah.
And if you don't finish it before the course, you don't finish the course and you start feeling better and you stopped it.
Yeah.
Have you done that before?
Okay.
And if you do work in healthcare
Mm-hmm.
and you see people coming and it's the same disease all over and all over again, and it's the same, they're not getting better. Do you keep records of this?
Okay.
And to other Nigerians, what actually stops you from going to the hospital, from the clinic, going to the clinic, going to the hospital? Why do you feel like you can't go there? You need to go to a pharmacy first.
Okay.
I think if you can answer, and based on all the conversations that we've had this morning, if you know the answer to that, I think the opposite of that is what we want you to do. You should go to a clinic first.
Okay.
Whatever the barriers are, maybe voice it out when you go to the clinic, see how it can be better. If you don't finish your antibiotics or any medication you're on,
Okay.
and you share it with
a
member of your family, you're not helping them.
Ah.
You're not even helping yourself.
Okay.
And then if you do work in healthcare, please try to keep records. And if you do have a business, a pharmacy, a chemist, please ensure that you prescribe, you don't give out or don't dispense medications without prescription.
Okay. And for the government,
And
proper
for
enforcement?
yes, proper enforcement. I think the government have their work cut out for them. Proper enforcement, and we look forward to always, creating more awareness.
Okay.
And you can always find a lot of questions. Follow us on our social media pages.
Okay.
Listen to a lot of the information we put out there.
Okay.
Our website is one quick place you can always go to find information. www.nigeriahealthwatch.com. Our Facebook, Nigeria Health Watch.
Okay.
Twitter, @Nige Health Watch, Instagram, Nigeria Health Watch. These are places you can always find information about your health. Thank you.
Okay, thank you, Dr. Eke, for joining us. I mean, as she has said, you can find all this information. You can also check the Ministry of Health website. You could check all these government agencies that are mandated to safeguard your health. You can check the Ministry of Health website. If you want to check about drugs, you could check the NAFDAC website. You could also, if you want to learn about diseases, you could check the NCDC website as well. It has been a pleasure having you join us today. Thank you so much.
You're welcome. You're welcome.
All right, then. And that's where we wrap up the roundtable today. Join us again tomorrow at 8:30 a.m. Now, coming up after the roundtable is the news update at 10 a.m., followed by the Clean Slate with Omoife and Henny. My name is Tokumbo. Thank